Hey docs, let's go over the wall angel functional assessment. So what you're gonna do is have the patient stand with their back against the wall. You're gonna make sure their heels are against the wall. You're gonna make sure their butt is against the wall. You're gonna make sure their low back is against the wall, their upper back, shoulders, head, and then you're also gonna make sure that their arms are placed in a 90-degree angle as best you can. A little bit higher up, just like this. Make sure that the shoulder is as in line with the elbow as you possibly can and the elbow is in line with the wrist, right? So now, the next thing you're doing is you're going to assess exactly what's going on and what's wrong. Now, if it is painful for them to put their arms in this position, that's going to indicate we have more of an external rotator cuff issue. Now, it doesn't mean that that's the primary issue or problem. It means that there is a concern there. Maybe there's some compensation, right? If they cannot get their arms against the wall, but it's not painful, then we're looking at more of an internal rotator cuff problem. If there's pain over the acromion process, that's more of an impingement syndrome or a generalized rotator cuff problem. This is a fun one. What you're gonna do is reach right behind here, and what you're doing and seeing is if that scapula, specifically the inferior border of the scapula, is flat up against the wall, and see if you can put your fingers between their scapula and the wall. If their scap is not against the wall, what you're looking at is probably some rotator cuff issue, but also a scapular dyskinesis. Remember, it sounds funky. It just means there's some dysfunction of the scapula, and we need to correct that. The very last thing is to see if their low back is against the wall. That should be flat. Notice how it is not. If that is not the case and their back is not flat against the wall, they can step forward a few inches and then see if they can actually posteriorly tilt a little bit and get their back against the wall. If it's still not against the wall, or if it's difficult to get against the wall, then we're looking more at a psoas or hip flexor contraction. Let's get to work, docs.